Hi, welcome back. Thank you so much. Step number 3, how to properly diagnose your dog's ACL injury. If you're just picking up with this, make sure you check out videos number 1 and 2. They'll give you kind of the background on your dog's anatomy and the function of the ACL ligament. But let's get into diagnosis here. We're going to show you a video in the next slide, and I want to make it really clear and set that video up. So as we come here, I'll actually pause this video. Okay, so what we've got going on is this is an excellent surgeon at Michigan State University, one of my mentors, Dr. Loic Desjardins, and in this video, he's got the femur in his right hand and the tibia in the left hand. Okay, and if you go back to the anatomy video, this will be very clear to you what's going on. He's going to take the two bones and try to move them with respect to one another. This demonstrates the instability in the knee. This is the most important test for determining whether or not a dog has torn their ACL. Now, if the ACL is only partially torn, there may not be any observable instability. If the ACL is completely torn, there will be observable instability. So let's take a look at this video. Alright, so femur in this hand, tibia in this hand, and motion. You see these two bones moving with respect to one another? That's significant instability. This dog has a complete tear of its ACL ligament, and furthermore, the amount of instability here is so much so that the joint on the inside is going to be damaged as a result of that movement. The meniscus will likely tear, and arthritis will progress rapidly. So the direct drawer method is where you actually take the two bones, femur, tibia, grab them within your hands and move them with respect to one another. Another way of testing is with indirect drawer. Here, we're going to mimic the dog taking a step and bearing weight with the left hand, and with the right hand is feeling for that same instability. This test can be less painful for the dog, and when we talk about testing for drawer, you may read sources that say this testing actually inhibits the knee from stabilizing itself with scar tissue. I do not think that's accurate. As you can tell, the knee moves with every step when testing for drawer. So it's no different, this test, than your dog taking a step when going outside to use the restroom. I think it's a very important diagnostic test that should be done, and certainly indirect drawer is unlikely to cause any additional injury to the knee. Let's take a look at the next video. This video is going to show an x-ray, a continuous x-ray called fluoroscopy, and that's showing the two bones moving with every step. You can see it here on the left, the femur and the tibia. And the tibia is moving forward with each step. Again, this diagram depicting what's actually taking place, this being the x-ray. There are other things on physical examination that can indicate a dog may have torn their ACL, such as muscle atrophy. This dog, the left leg here, is much skinnier than the right leg. Effusion, we can actually feel the dog's knee is swollen. Effusion is a term that means joint swelling, excessive synovial fluid within the joint, or too much joint fluid. The joint fluid is the result of inflammation. Inflammation is the result of the ligament tear and the instability in the knee. That instability leads to scar tissue being laid down in the knee, which forms the buttress. It's also called a medial buttress. It's on the inside of the dog knee, and it's kind of like a knot or a goose egg right in between the two bones, and it's the body's attempt at stabilizing the knee. We can talk more about the body's attempt at stabilizing the knee later. For now, in general, with complete tears of the ACL, the body does a poor job of stabilizing the knee satisfactorily. Trochlear osteophytes, fancy words for saying arthritis of the knee. You can actually feel arthritis in the knee on some cases. Finally, there will be pain on extension of the knee. And sometimes, if the knee is unstable and damages the meniscus, as seen in video number 2, step 2, you can hear a clicking sound. That should be clicking, not clinking. All right, let's go ahead and move on here. Okay, X-rays can be helpful in diagnosing a cruciate tear. We talked about in video number 2 that you can't actually see the ACL on an X-ray. What you can see is indications that that ligament might be injured. This is a normal dog knee on the left and a dog knee with an ACL tear, early ACL tear on the right. On the left, you can see that the bottom of the kneecap is nice and smooth. On the right, the bottom of the kneecap has osteophytes or bone spurs or arthritis. Also, we can see one difference between these two x-rays is that inside the joint here is a line, okay? That represents the normal joint fluid and meniscus within the knee. On this x-ray, that line has disappeared and there's a fuzzy outline here and it goes all the way up here. This is effusion or joint swelling. It's excessive fluid within the joint, probably the earliest indicator of an ACL tear. As we follow a knee that's undergone an ACL tear, it goes from early signs with just some effusion here, hardly an osteophyte or arthritis or bone spur at the end of the patella, to this x-ray here, where there's significant effusion. You can see that fluid coming all the way out here. You can see we're starting to get major bone spurs at the kneecap. We're even getting some bone spurs up here at the top of the trochlea, which is the part of the femur. And then down here is an even further progression of arthritis. Major bone spurs, starting to get bone spurs in the back on these fibellas. And then still the effusion here, even some changes to the tibia. And then finally here, this is a view of the knee looking at you, and you can see all these irregular bone spurs that are indicative of arthritis. Every dog will progress through the phases of arthritis after an ACL tear. Our goal is to minimize that progression. All right, that concludes step 3. We'll see you for step number 4. Thanks so much.